Cancer is a complex group of diseases marked by the uncontrolled division and spread of abnormal cells in the body. Unlike normal cells, which grow, divide, and die in an orderly manner, cancer cells evade these regulatory mechanisms, leading to the formation of tumors or the invasion of healthy tissues. These malignant cells can originate in almost any part of the body, giving rise to various types of cancer, such as breast, lung, prostate, or colorectal cancer. Each type behaves differently, requiring tailored approaches for diagnosis and treatment. The causes of cancer are multifaceted, involving genetic mutations triggered by factors like environmental exposure e.g., tobacco smoke, UV radiation, lifestyle choices e.g., poor diet, physical inactivity, and inherited genetic predispositions. While some risk factors are beyond an individual's control, many can be mitigated through preventive measures. For instance, avoiding tobacco, maintaining a healthy weight, and protecting skin from excessive sun exposure can significantly reduce the likelihood of developing certain cancers. Early detection plays a pivotal role in improving survival rates and treatment outcomes. Many cancers, when caught in their initial stages, are more responsive to therapy and may even be curable. Regular screenings, such as mammograms for breast cancer or colonoscopies for colorectal cancer, are vital tools for identifying abnormalities before symptoms arise. Public awareness of common warning signs, like persistent fatigue, unexplained weight loss, or unusual lumps, can also prompt timely medical evaluation. By understanding the nature of cancer, its causes, and the importance of early intervention, individuals can take proactive steps to protect their health and seek care when needed. Cancer often presents subtle early signs that can easily be overlooked or mistaken for less serious conditions. One of the most common warning signals is unexplained weight loss, particularly when a person loses 10 pounds or more without changes in diet or exercise. This can occur because cancer cells consume energy or disrupt metabolism. Persistent fatigue is another red flag. Unrelenting exhaustion that doesn't improve with rest. Unlike ordinary tiredness, cancer-related fatigue is often debilitating and may result from the body's resources being diverted to fight the disease. Unusual lumps or swelling in any part of the body should never be ignored, especially if they grow or change over time. While many lumps are benign, they can also indicate tumors in the breast, lymph nodes, or other tissues. Skin changes, such as darkening, yellowing, or excessive bruising, may also signal underlying issues. Additionally, persistent pain that doesn't have an obvious cause or worsens over time could be a symptom of cancers like bone or ovarian cancer. Other less specific but noteworthy signs include prolonged fever, night sweats, or frequent infections, which may point to blood cancers like leukemia. Difficulty swallowing, chronic indigestion, or appetite loss are also potential indicators of digestive system cancers. While these symptoms don't always mean cancer, recognizing them and consulting a doctor promptly can lead to earlier testing and diagnosis, improving the chances of successful treatment. Awareness and proactive monitoring are key. Ignoring these signs or delaying medical advice can allow cancer to progress unchecked. Different types of cancer manifest in unique ways, making it essential to recognize the specific symptoms associated with each. For instance, colorectal cancer often presents with changes in bowel habits, such as persistent diarrhea or constipation, blood in the stool, or abdominal discomfort. These symptoms may develop gradually, so paying attention to prolonged changes is crucial. Similarly, lung cancer is frequently marked by a persistent cough that doesn't resolve, shortness of breath, or coughing up blood. Since these symptoms can mimic common respiratory issues, their persistence should prompt further investigation. Breast cancer, on the other hand, may reveal itself through lumps or thickening in the breast tissue, changes in skin texture, or nipple discharge. Regular self-exams and mammograms are vital for early detection. Prostate cancer often progresses silently, but in some cases, symptoms like difficulty urinating, blood in the urine, or pelvic pain may appear. Men over 50 or those with a family history should discuss screening with their doctors. Skin cancer, including melanoma, can be identified by new or changing moles, irregular borders, or unusual coloration. Sun exposure and genetic factors play significant roles, so regular skin checks are recommended. For cancers like ovarian or pancreatic cancer, symptoms are often subtle and easily overlooked, such as bloating, unexplained weight loss, or persistent indigestion. Awareness of these signs and seeking medical advice early can lead to earlier diagnosis and better outcomes. Recognizing the distinct symptoms of each cancer type empowers individuals to take action and consult healthcare professionals promptly. Cancer risk is heavily influenced by lifestyle choices, many of which are within our control. Smoking, for instance, is one of the leading causes of lung cancer and is linked to several other types, including throat and bladder cancer. The harmful chemicals in tobacco damage DNA and weaken the body's ability to fight abnormal cell growth. Similarly, excessive alcohol consumption raises the risk of cancers such as liver, breast, and esophageal cancer. Reducing or eliminating these habits can significantly lower the chances of developing cancer. Diet and physical activity also play a critical role. A diet high in processed foods, red meat, and sugary drinks has been associated with an increased risk of colorectal and other cancers. Conversely, consuming a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can bolster the body's defenses. Regular exercise helps maintain a healthy weight, reducing the risk of obesity, related cancers like breast and pancreatic cancer. Even moderate activity, such as walking 30 minutes a day, can make a difference. Environmental and occupational exposures, such as asbestos or prolonged sun exposure, are additional risk factors. Protective measures like using sunscreen, wearing protective gear, and avoiding known carcinogens can mitigate these risks. Regular screenings, such as mammograms, colonoscopies, and skin checks, are vital for early detection, especially for individuals with a family history of cancer. Vaccinations, like the HPV vaccine, also prevent cancers caused by viral infections. By adopting healthier habits and staying vigilant with screenings, individuals can take proactive steps to reduce their cancer risk and improve overall well-being. Diagnosing cancer begins with recognizing symptoms or risk factors, prompting medical evaluation. Doctors use a combination of tools to confirm the presence of cancer, determine its type, and assess its stage. Imaging tests like X-rays, CT scans, MRIs, and ultrasounds provide detailed pictures of internal organs, helping locate tumors and evaluate their size and spread. PET scans may also be used to detect metabolic activity in cells, identifying areas where cancer is likely present. These non-invasive methods are often the first step in narrowing down potential issues. If imaging suggests abnormalities, a biopsy is typically performed to collect tissue samples for microscopic examination. There are various biopsy techniques, including needle biopsies for easily accessible tumors or surgical biopsies for deeper tissues. Pathologists analyze the samples to confirm cancerous cells, identify the cancer type, and sometimes test for genetic markers that influence treatment decisions. Liquid biopsies, which detect cancer DNA in blood, are emerging as a less invasive alternative for certain cancers, though they are not yet a standalone diagnostic tool. Blood tests play a complementary role by measuring tumor markers, substances like PSA, prostate-specific antigen, or CA125 for ovarian cancer, that may indicate cancer. While not definitive, abnormal levels can signal the need for further testing. Early and accurate diagnosis is critical, as it allows for prompt intervention when cancer is most treatable. Advances in diagnostic technology, such as AI-assisted imaging analysis and genetic profiling, continue to improve precision, reducing delays and uncertainty in the diagnostic process. Patients are encouraged to seek medical advice if they experience persistent symptoms, as timely diagnosis can significantly alter the course of treatment and improve survival rates. Cancer treatment is highly individualized and depends on the type, stage, and overall health of the patient. The primary treatment options include surgery, chemotherapy, radiation therapy, and targeted therapy, often used in combination for the best outcomes. Surgery is typically the first line of treatment for solid tumors, aiming to remove the cancerous tissue entirely. Advances in surgical techniques, such as minimally invasive procedures, have reduced recovery times and improved precision. However, surgery may not be suitable for cancers that have spread extensively or are located in hard-to-reach areas. Chemotherapy uses powerful drugs to kill cancer cells or stop their growth. It can be administered orally or intravenously and is often used before surgery to shrink tumors or after to eliminate remaining cells. While effective, chemotherapy can cause side effects like nausea, fatigue, and hair loss due to its impact on healthy cells. Radiation therapy, on the other hand, uses high-energy beams to target and destroy cancer cells locally. It is commonly used for cancers like breast, prostate, and lung cancer, either alone or alongside other treatments. Modern techniques, such as intensity-modulated radiation therapy (IMRT), minimize damage to surrounding tissues. Targeted therapy is a newer approach that focuses on specific molecules involved in cancer growth. Unlike chemotherapy, it aims to spare healthy cells, reducing side effects. Immunotherapy, another innovative treatment, boosts the body's immune system to fight cancer. Treatment plans are tailored to each patient, considering factors like genetic markers and tumor characteristics. Multidisciplinary teams, including oncologists, surgeons, and radiologists, collaborate to design the most effective strategy, ensuring the best possible quality of life during and after treatment. A cancer diagnosis can be overwhelming, not only for the patient but also for their loved ones. Emotional, physical, and practical challenges often arise, making support systems invaluable. Support groups provide a safe space where patients and families can share experiences, fears, and advice. These groups, whether in person or online, foster a sense of community and reduce feelings of isolation. Hearing others' stories can offer comfort and practical tips for managing symptoms, side effects, and the emotional toll of treatment. Professional counseling is another critical resource. Mental health professionals specializing in oncology can help patients and families navigate anxiety, depression, and counseling sessions provide tools to cope with the emotional roller coaster, improving overall well-being and resilience. For many, talking to a therapist or joining group therapy sessions can make the journey feel less daunting. Educational resources are equally important. Reliable information from trusted sources, such as cancer organizations, hospitals, or government health websites, helps patients understand their condition, treatment options, and what to expect. Knowledge empowers individuals to make informed decisions and advocate for their care. Additionally, workshops or seminars on nutrition, pain management, and survivorship can enhance quality of life during and after treatment. Community support, including financial aid programs and transportation services, can alleviate practical burdens. Many organizations offer assistance with medical bills, medications, or even meal delivery. Connecting with these resources ensures patients can focus on healing rather than logistical stresses. Ultimately, a strong network of support and information is a cornerstone of coping with cancer, providing hope and strength throughout the journey.